Hello and welcome to the Cameo Show. I'm your host, Cameo. And today we have our dear friend and also an expert in the heart health area, I'm sorry, Michael. Her husband, Michael, would be very mad at me for calling her Mrs. Abby Gamby. Hi, Abby. Thanks for being here.
Thanks for having me.
And as always, we have my husband and co-host, Mr. Greg Braun.
I'm so excited to be here. This is a very special episode. It means near and dear to my heart.
It means near and dear to your heart?
Well, Abby's near and dear to my heart, but we're going to be talking about the heart. So this is just full of heart, this episode.
Yes.
You're right.
Very heartfelt.
Well done. Well, Greg, you started us with a dad joke. So do you have one for us today?
I do. Why couldn't the bicycle stand up by itself?
I don't know.
Because it was too tired.
Good. Too tired. Well, without further ado, thank you for that, Greg.
That's for all those moms and dads out there that are tired because we're driving all over the place. We're running all over the place. We're doing all this stuff. We're just doing too much.
We're doing too much.
And
that is a great segue to Mrs. Abby Gamby, because she has two very busy, involved athletic teens that she's running all over the place. And a wonderful husband, Michael, who she is probably busy with taking care of him as well. And her expert role here, though, what we're talking about today, is she's a certified nurse practitioner, took on the nurse practitioner role in 2009, and she's currently working in an outpatient cardiology and electrophysiology clinic. And you've been doing that for the last 8 years.
Correct.
So on the daily, you are working with heart patients. You are working with patients on making sure that their cardio health stays or returns to where it needs to be.
Yes, optimal health is what we shoot for them. And it's, electrophysiology. So that's heart rhythm disorder clinic. And then the other focus on general cardiology, which is overall heart health, blood pressure control, cholesterol control, just health maintenance, and a plethora of coronary artery disease or heart problems. So,
yeah, heavy stuff.
Yes.
Well, this came about because we were having a conversation with Mike one night, and he mentioned that Abby had given a presentation about our wearable devices that track our heart rate, our HRV, our sleep, all of these different things that we're all obsessed with. I mean, we're just, as a culture, obsessed with our wearables, our Apple Watches, our Whoop monitors, our Oura rings. I was sharing with you before we started that I literally wake up and check my Oura ring every single morning to see what my ring tells me I have done well and what it tells me I suck at. I'd like to start there and then maybe branch off into some just general heart health information, because the majority of our listeners are interested in taking control of their health by activity, by diet, and mostly by understanding, what does all of this mean to me? Yeah. What are the things that I need to be paying attention to? And what are the things that are just noise? Because there's a lot of that too. Yeah. So if we could start maybe with some information about the heart monitoring wearable devices that so many people have. Can you talk to us about the accuracy? Can you talk to us about what these numbers actually mean from your standpoint as a nurse practitioner, and what you see with your patients, and just general information about them?
Yep. So I would say by far we know the majority of users wear the Apple Watch, and not to get too, with one brand, but that is by far the most popular thing that we see is the Apple Watches, and they track from depending on what generation you have, starting at 4th generation is where they will track your heart rhythm, or if you're having irregular rhythm. And that's what we're looking for. In the general population, if you get an irregular rhythm, that's where you want to take the next step and make sure it's not a concerning rhythm. So the Apple Watches have the capability to record that. If you get an alert, you record the abnormal rhythm. And when it's recorded, it is good accuracy. So all our studies and data we've looked at, or has been looked at, has shown these are up to the Apple Watches. Again, the other wearables include Oura rings, or there's many different types of rings, or what we use, paired devices that you can connect ultrasound wave. It's called a cardia device is the main one that's used. Anyhow, these are all up to like over 95% accurate at detecting abnormal heart rhythms.
So the rage and the excitement around these rings and devices and Apple Watches it's reasonable. Like it's not just a fad. It's not just something that like might give you some information that's helpful. It's extremely accurate.
It is. And we use the data that people bring in because we know the accuracy and because we can view the EKG recording. So that's the rhythm that you're seeing. And we can view it and we can see what's helpful for us as like providers is if someone brings that in concerned about a heart rhythm, we can tell them and coach them, this is, sometimes we'll say it's artifact, meaning you can see right away it's on the sheet of paper where the recording comes across. If it looks like crazy all over the place of the rhythm, then that's not normal. That means it was not a good connection, and we can give some peace of mind. This is what we call artifact. Don't worry about that. It wasn't a good connection to your wrist, to your finger. So a lot of times we'll get people really worried about something that's not even worried. So it eases their mind to bring that in.
Sure.
So we see that. And then secondly, we can see that if there is something abnormal that looks abnormal, we're able to address it quicker than if they didn't have a wearable device. So that's, in our eyes, the biggest benefit is pulling out something early. The biggest risk, and I've just put this out there because it's the number one abnormal heart rhythm is atrial fibrillation. And if someone's having that and doesn't realize it, and they have other risk factors, that's where you're at risk for stroke. So this is why in our world, these monitors have been very helpful, whether someone has AFib as a new onset or they've had it and now we're finding it while they're wearing it helps guide treatment.
If I don't have something that's tracking that for me, are there symptoms or are there indicators that I would pick up on that being something of concern for me? Or does that kind of happen almost too late in the process? Like, can you explain that a little bit more?
That is a very good question. So, and this is where it's challenging because every human being is different and what they feel when they have their arrhythmia or AFib or other heart rhythms. But AFib is the bigger one that often goes unnoticed because some people feel nothing. It's totally the same, no difference. It's almost, just in my experience, I'd say people that have normal heart rates and they happen to go into AFib may not notice anything at all for a long time, but some subtle symptoms like fatigue, increased fatigue. Why am I all of a sudden tired, mowing the lawn, push mowing my small lawn, whereas I used to not be? Like that's sometimes something that gets tricky because people don't realize the fatigue, a change in level of fatigue could be a sign, I should say, of arrhythmia. Shortness of breath is the main one, increased shortness of breath, or like a butterfly feeling, flip-flop feeling in your chest. Those aren't normal symptoms. Unexplained feelings like that would encourage someone to get, talk with their doctor or get further evaluation with EKG is a quick, simple way in an office to check a rhythm. Now, again, if you happen to have one of these as well, they are, again, pretty accurate.
And an Oura ring would do the same.
I believe so. Yeah. I didn't look as much detail on those, but I know they track the heart rate the same way. Okay. So I can honestly say I don't see that one used as often, just in my practice, but I know that it uses the same technology as the Apple Watches with the infrared light on the ring itself, which again was looked at in the studies, and it showed similar, over 95% accuracy in detecting abnormal heart rhythm.
Can you talk a little bit more about the technology and how that works to read these on our wrists, on our fingers?
There's an infrared light, and it's basically picking up the blood flow pulsations through the artery or through your finger here or through the wrist, the pulsations of the blood flow. And so it's tracking the rhythm, if it's regular, irregular, and the rate, how fast. So that's what it's basically telling you, how fast or slow your rhythm is, and if it's regular or irregular as far as rhythm goes. And then that's what I'm more familiar with. But then I know there's also all the other tracking, as we were talking before, with the sleep scores and sleep blood oxygen. So because it's reading the blood, it's able to track the blood flow. It's also, some of them are able to track blood oxygen levels.
Our rings track our blood oxygen level.
Yeah. At nighttime.
Yeah. And so with regard to sleep, and maybe it's not something that you can speak to necessarily specific to the devices, but while we're on it, can we talk about the importance of sleep in overall heart health?
Our biggest thing, and especially, getting into middle age, is awareness of sleep apnea. I know that's not something we touched on, but this is what also these can track and pick up, is if you're having low blood oxygen levels at nighttime, but tracked by your device, whether it's your watch or your ring, that's concerning. So you do not want your oxygen levels dropping below 90 while you're sleeping. That's not normal. Anything below 90, 80s, 70s while sleeping is abnormal, or what we'd call sleep disordered breathing, potential risk for sleep apnea, which then carries a laundry list of risk of other comorbidities, such as like high blood pressure, risk of stroke, risk of AFib, or risk of heart rhythm issues, risk of heart failure. So, and that is, again, over time. It's not something that happens overnight, but over time, if someone's not aware about oxygen levels at night, that's one big thing that I think these are helpful for tracking.
Yeah. And I think that's an overarching theme and statement to make about these, is that the data is accurate, but also it allows you to track the trend. So as you mentioned, all humans are different. My HRV, my heart rate variability number, which if you could explain a little bit about that, that would be amazing. But like mine looks totally different than Greg's, and it looks way different than Faith's. Our daughter is 19. She has an Oura ring and her HRV is like through the roof all the time, like super high. And I'm super jealous of that. But obviously there's a 20+ year gap in age and physiology there that makes a difference. So can you talk to us about HRV and speak to the fact that these trends are things that help your patients make sure that they understand their own trends versus maybe just what they Google should be the right thing?
Yeah, this is another thing that they're an excellent source for. And we all, people will bring in a lot. Like, look here, my heart rate, when I'm sitting and haven't been doing much throughout the day, is 120. That's not normal either. So you don't want resting heart rate should be below, technically probably in the 80s, below 90 normal. But you also should see the heart rate going up, like you're talking about, probably with physical activity, running, walking, climbing stairs throughout the day. You do want to see that rate go up, so that's normal. There's no concern when you see heart rates, knowing you were at the gym or you were maybe outside working in the yard. That's normal for the heart rate to be 110, 120. No concern there. More concern is resting heart rates elevated, unexplained elevated. Other thing would be if you were not getting an increased heart rate response to activity, which can happen with age. So as you mentioned, as we get older, 40s, 50s, 60s, 70s, our heart rate variability is not as robust as like Faith would be at 19. You still want to see some, though. It's important that, and it does speak to heart health, meaning your electrical conduction through your heart is normal if it's going up appropriately with activity. But if it's not, there's a little more data showing some risk for increased heart disease if you're not getting appropriate heart rate response to activity, especially our older population. And I'm talking over age, like let's say 80, 70, 80, occasionally younger, but like really blunted heart rate response to activity can show a significant decline in electrical conduction. So
sure, that makes sense. I guess I look at mine, for example, I'm always perplexed when you mentioned, like, I'm just sitting here working and my heart rate is a little on the higher side and I'm not really doing anything. So I take some deep breaths to like calm myself down. Maybe I'm experiencing just some stress and anxiety around the work that I'm doing, bring my heart rate back down. I also then notice sometimes, like, we do a lot of boxing training, a lot of kickboxing and martial arts. Sometimes I feel like I'm just completely gassed. Like I could just bend over and just take in deep breaths, just sucking in air, trying to catch up. And I look at my stats from my workout and my heart rate didn't really go like out of zone 2. And I'm like, how is that possible? I was nearly dying. Like, where's the correlation between knowing that you're pushing yourself in physical activity hard enough, but not too hard, and also like some of the things that would cause my resting heart rate to spike? Those are two very different questions that I just threw at you all at once. But if we can break those down in a more organized way.
Yeah.
I
then I
think,
presented them to you. That would be great.
well, before Abby gives us the answers, I think you're faking it. You're not giving it your all, and you're stopping. And the ring doesn't lie.
See, Greg and I spar each other, and when you say those things, Greg, you're just kind of asking for it, you know? You're
Yeah.
just asking for me to turn it up, and that could be dangerous for you, my friend. So, idle
Or was
threat.
Greg winning at that time? So you're like, I'm done. Yeah.
Well, probably not. No, could have been.
Yeah. So I think to answer your first question, or maybe it was your first question regarding if you're at rest and you're noticing your heart rate's up, but you're also correlating it with increased stress, anxiety, that is very normal. So there's stress hormones released when you're upset, you're emotional, you're nervous about something for the day or something happened. You are going to have a little bit higher heart. Oh, the other thing is pain. Obviously we expect heart rate to go up with pain. If you're in pain from sparring with Greg or whatever it may be, the heart rate's going to be up at rest, maybe 90 to 100 or more. But then, like you noticed, you did the deep breathing. There's direct correlation with, deep breathing, relaxation techniques that lower heart rate. And yoga, all those things really lower heart rate as you do those calming exercises. So that is, normal with stress to go up like that, normal to go down as you do your relaxation, which is why those techniques are so good. To follow that up with your other question, which was, about the breathing.
Yeah.
And you're feeling really short of breath or like really winded when you're working out, but you don't think your heart rate's where it should be to be feeling that winded. Is that what you're saying?
Yeah. I mean, I feel like I pull up my numbers after the workout where I'm like, today was really difficult. I felt really gassed in a way that, I was pushing myself harder than I feel like maybe I normally get to that level. And I pull up my ring and expecting it to be like, your heart rate's 180, and it's like 120, zone 2 the whole time. And I'm like,
that was my next question, what your heart rate was. So it was 120, which was your normal for being exercising. Yeah, that's a tough one to tease out. I mean, certainly it might not have been related to the heart rate or something. It could have been maybe that day, something different where more, again, more stress that day or more upset, that your body in general just was more tired.
Do I understand correctly that as your physical fitness level increases, though, that your heart rate, how high it would go during a strenuous workout, it would be normal for it to be low on the lower side than maybe if you were inactive and then just went out and started running sprints and is that an accurate statement?
Yeah, I think so. And I think, again, the age part has a little bit to do with it versus like, when we're 18 to 20s, we can tolerate heart rates 170, target heart rates when you exercise 170, 180 is more manageable with your breathing versus 120 is more 130, 140. As you get a little older, your target heart rate goes down. So your body, you really wouldn't maybe feel well if your heart rate was even higher. Like you're saying, you expected it to be higher, like 160, 180, but it's unclear maybe that day that happened, why, I guess. But
well, I just I look over at Greg and he's usually like breathing heavier than I am, struggling. I know he's not working nearly as hard as I am. And then his heart rate's like higher than mine. And I'm like, what? Like I'm putting out so much more extra energy and effort. So I got, that's why I was chalking it up to my level of fitness is just that much higher.
It could be because you ran a lot, right? Like you were a runner, and Greg, you didn't do as much distance. Is that right?
Well, we did the Columbus Marathon together.
Oh, okay. Yeah.
We ran a lot that summer.
We did. I would say though that collectively I've definitely put in more miles over a longer period of time than Greg.
Okay. So I think anybody that's run distance running, any like of athlete that's kept very high level, Greg, not that you didn't, but
no.
High level of aerobic exercise, whether it's marathons, half marathons, triathlons, they almost throughout, and I've just seen this through some patients we've had, they're throughout their lifetime, their heart rates do run a little bit lower. At rest. And like you're saying, I'm guessing probably more, I have never really discussed that with them, but like when they're active and running and different things. People get worried a lot if they are really active or if they have a resting heart rate that's low, like 40s, 50s. And we'll get the question that a lot. If you're not having any symptoms and your heart rate's that low, it's okay. Meaning that's the frequent thing that comes in is like, well, it's called bradycardia, meaning low heart rate. And that's sometimes people's baseline heart rate is lower as long as you're not having any symptoms. Then there's no concern.
Well, hers is lower. Her heart rate is lower than mine. So,
and when I wake up in the morning, my resting heart rate overnight is sometimes in the 40s.
Yes.
Is that's
typical
normal? That in your sleep, when you're not moving and you're at complete rest, your heart rate drops off from when you're not active but awake. Yes.
Yes, correct. Okay. And that's the other question we'll get is the heart rate at sleep will drop into the 40s for a lot of people, and that's okay.
Yeah.
And I don't quite recall the physiology, like it's not necessarily an issue. It's just when we sleep at nighttime, our heart rates, our bodies are so, relaxed and rested, the heart rate slows way down from our baseline. Mm-hmm.
Interesting. This is maybe more on the exercise side of things, but to me, it's still heart related. The difference between aerobic and anaerobic exercise.
From our standpoint, we certainly encourage aerobic exercise. So we do know that getting the heart rate up with aerobic exercise, currently the American Heart Association's it's recommended 150 minutes a week for aerobic exercise. Most people don't get that. That's hard. So aerobic exercise is super important for blood pressure control, cholesterol control, diabetes, weight. So I would say we, of course, working in a heart office, strongly favor aerobic exercise. Getting that heart rate up is so important to prevent many things, and even heart rhythm issues are very well prevented by getting your heart rate up like that. Aerobic exercise.
30 minutes a day is the standard.
Well, or, if you can, they say 150 minutes a week. So that's almost every day doing something to get your heart rate up, is the current recommendation. So,
and when you say get your heart rate up, what is that? Obviously that differs from person to person, based on what their base level is, but is there like not a range, but like a
zone 3?
Yeah. Like where it correlates to your own heart rate, how far it should be from your resting, or how do you measure?
Yeah, I don't think there's anything that specific I've seen. It's basically and this is for the general population. Some people are certainly I think you both are very good with being very aware of your fitness levels and what you need to be doing, but then a lot of people aren't. So we just really encourage like you said, every person's different. Some people have done no physical activity for a very long time for whatever reason. So we say, start where you can. Start, 10 minutes a day, 15 minutes a day, walking. What can your body do? But if you can't walk, you can't run, if there's something stationary you can do, get on a bike. If you can't do that, can you get in the water? Can you get in a pool and walk? And then keep building. So it depends on, literally, it's unique for each person, and not specific range of heart rate. It's just a matter of doing something physical more than what you are currently doing.
Just so your heart rate isn't staying at just kind of where it is when you're resting, so that you do see when you do that activity, that spike in a heart rate over a period of time.
Yeah. Makes sense. And doing that will eventually, over several months, usually we say, 2-3 months, will improve those things that maybe you're trying to work on, whether it be blood pressure, cholesterol, weight.
While we're heading in that direction with regard to general heart health, Greg and I get our blood work done annually. We are due, Greg, so we definitely need to get that taken care of. But we both have, even, as active as we are, as mindful of our nutrition as we are, we're nowhere near perfect. I just inhaled birthday cake for an entire week.
I was going to say, I'm going to call myself out. I literally just had a piece of cake and it was amazing.
Easter candy and birthday cake all in the same week. It's been insane around here. So I'm not saying we're perfect, but we're very mindful. And so, but our blood work has shown that we have slightly high LDL cholesterol, the bad cholesterol that you're not supposed to have. And Greg is on the higher range of where his blood pressure should be. So what are things that impact our heart with regard to nutrition and activity, those things specifically, blood pressure and cholesterol, that we can be mindful of in our day-to-day, our busy lives, running from place to place to try to keep those where they need to be?
Yeah. And that's, And that's a good one because that's hard because, like you said, we have very busy lives and sometimes it creeps up on you as far as blood pressure slowly over time, and can be genetic, definitely, which is challenging. There's nothing you can do about genetics if your family history of blood pressure or heart disease, that's where it's important to be very mindful of your diet, which again, we generally would recommend like Mediterranean diet. That's been shown to be very beneficial for heart health and cholesterol. The Mediterranean diet would include a lot of fish, omega-3s, olive oil is the main oil that a lot of times, people don't recognize or realize, like coconut oil had a lot of, rave as far as benefit, but there's a lot of saturated fat in coconut oil. So we really encourage more olive oil, avocado oil. The healthy fats do help cholesterol. And then it's, I said fish, chicken, nuts, greens, fruits, minimal processed foods, minimal red meats, in a nutshell.
We love steak. You had me.
Yeah.
Blank steak, and we're just heavy on the red meat for sure. That's probably where.
I think that is the hard one, especially like if a lot in your lifetime, maybe throughout your life. I mean, Mike Gamby ate a lot of a lot of red meat.
Yeah.
So he's just growing up how he on the farm and different things. I mean, that was a lot. I mean, he loves red meat and I like it too, but that's a tough one for a lot of people. I'd say that's the biggest kind of pushback from that diet when we talk about it is the red meat. So we don't say you have to eliminate it altogether. So I mean, certainly just again being mindful. Okay, maybe I have it once every other week. It's better than having it 3 times a week. So
like I need to get it down to once a day, and then I can be maybe a little healthier.
And it also depends on your numbers, like you said. I mean, certainly if I had both of your cholesterol panels in front of me and they were reasonably healthy, then it'd be surprised to say, okay, maybe you can still continue to have your red meat once a week or twice a week. Now, on the flip side, if it's a different story if someone already has heart disease. But if we're talking preventative health care or preventative health, then certainly just trying to get your target numbers, that goal for you.
Yeah. Well, I cannot wait to get our results, and we'll email them to Abby, and we'll give it to us and let us know,
Yeah.
Because when we look at them, we're just like, what is all this? Pages of just numbers.
Yeah, and it generally will tell you, like, obviously that it should be giving you on the, like, what's normal range, what's not normal range. Yeah, which is probably pretty, for you guys' health, you guys are healthy people, would probably be accurate.
I've been noticing because I'm 42 and probably entering the perimenopausal conversation, like I do have some of those butterfly flutters. I do have some increased anxiety, and I haven't had my hormone panels done. I haven't done any of that yet, but I just feel like those are things that are popping up that I recognize that are new and different in the equation, that are like, oh shit, here we go. I'm in my 40s and this stuff is like something I have to pay attention to. And with regard to like the pattern of the ring, I think that's helpful for me because I don't obsess over it necessarily, but I do at least know where my heart rate is. I do know what my numbers are, and I know a little bit enough to be dangerous about what they mean. And let that kind of guide me. Like when I don't get a good night's sleep, usually I know it before I check my ring, and then it tells me, hey, you didn't get a good night's sleep, you dummy. You need more sleep. I was reading a book. It's called Scarcity Brain. Have you read it, Abby? It's by Michael Easter. Fantastic book. He has 2 books. Maybe he has more than 2, but Comfort Crisis and Scarcity Brain. And coincidentally, there's this page on health where he's talking about Whoops and different Oura rings and fitness trackers. And it talks about how people use their recovery score to determine what they're going to do next. Like, what am I going to do today based on my recovery score? I guess on my Oura ring, it would be called my readiness score.
Okay.
And I'm curious if you see people leaning into what their device says to dictate what they do with their activity levels or with their day-to-day, and if that can be dangerous, considering how accurate the information is, or if you should really hold tightly to like I got bad sleep, my readiness score is low, I should rest and give my body some time to recover, or go more based on how I feel or what I would normally do.
The patient population I work with is a little bit older, my average age probably above 70, but personally, I don't see it too often. I some ways wish people took a little more ownership of their health.
Sure.
Being proactive is so important. Like, we've kind of touched on knowing your numbers, knowing your blood pressure, knowing, is my heart rate symptom I'm feeling? Is my ring showing something weird? Those things, being so proactive, capturing everything early will, in the long run, over your lifetime, keep you much healthier.
Sure. On the things that sneak up, what are the things that you see that people maybe come in and they didn't have symptoms, they didn't realize, and then all of a sudden they're in this danger zone of having a stroke or having some type of cardiac disease, not to scare people, but just to be aware of as they're thinking.
Yeah, all the health maintenance. We could go through a pretty good list of things that cause high blood pressure, heart disease, risk of high cholesterol, stroke, heart rhythm issues. Starting at the top, I would say main ones: alcohol use and cigarette smoking. Alcohol use is directly linked to a lot of things in the heart world, as far as heart failure. I'm talking, again, heavier alcohol use over time. These are things that will catch up as far as blood pressure, heart failure, heart disease. Cigarette smoking as well. Nicotine is very hard on your arteries over time and can cause plaque buildup. And then, these are things two lifestyle things that are really important that we preach a lot about, as far as if we do have a patient that has a new diagnosis of a heart problem, those are two things that we really try to hone in on, trying to minimize. I know it's difficult, but that's two things. Second thing would then be weight, healthy BMI, your height to weight index, really under 27 for people is where you start to see anything above that, more health risk comes in, as far as blood sugar, diabetes, cholesterol. And so then the other one I would say would be exercise, like we have been touching on. So weight, exercise, and then healthy foods like the Mediterranean diet, low salt diet. Of course, if you have high blood pressure, talking to people about their diet, as far as what type of sodium they're eating. A lot of people aren't aware of all the sodiums that is hidden in our foods. So that's a big conversation. And then you mentioned sleep. That's a big one. We talked about importance of sleep and sleep disordered breathing, again, sleep apnea type of things, making sure you're aware of your sleep, healthy sleep. And then there's a final one I had on my mind. Oh, we touched on already, stress. Stress is a big one, as far as over time, chronic stress leads to chronic illnesses. We know that. And in the heart world, we see it with blood pressure, or again, there is a potential for heart failure. There's so much stress, can even have a stress-induced cardiomyopathy. So best we can, controlling our stressors, whether that be through, that's a whole nother talk on itself, but
Sure.
Yeah.
So that's that's a long list right there, but it's a long list of health maintenance. It's a lot.
That's a great list.
Yeah.
That was a great list.
I feel like it's something that everybody kind of knows, but maybe just because that's what you've always been told, but don't really think about the long-term consequence or severity of it. So having you discuss that from your position, seeing an older population, seeing it when it kind of is, maybe happening.
Yeah. And I should rephrase that, because we do have a lot of people that come in and they're maybe they don't have the technology we were talking about. That I was more touching on the technology. But then we do get people coming in a lot. And I would say the primary thing in 40s, 50s, 60s is, again, blood pressure issues, cholesterol, or early heart disease, whether it be unhealthy lifestyle or family history. So it's certainly, Greg, I think you said in the beginning, heart disease is the number one killer in America. So
yeah, that stat just blows my mind, because I would have never guessed that. And I would imagine a lot of people, general population that aren't in the medical world, wouldn't guess that. Maybe they would say cancer or something else. But just literally heart disease. And there's, and you literally just gave the list of the 10 commandments of things to do to offset, you know,
Correct.
to set yourself up for the success in that area.
Correct.
You know, so
Yeah. Yeah. It is so important. It's so important before, hopefully in your lifetime, you never have heart disease, but if you do get it,
yeah,
it's also it can really be a game changer, changing your lifestyle after a diagnosis of heart disease or heart rhythm issues,
yeah.
focusing on those things.
It's kind of like you give those rules to the game of life by
Yeah.
laying that out there,
Yeah.
and if you implement all of those things, I mean, just think about it. Like in our normal day, we get pinged with our phone and all this stress that we get from driving all over the place. I mean, we are overstressed. So if we don't do
Yeah.
something consciously, proactively to offset that said stress that we are getting pounded with every day,
Mm-hmm.
you can't just accidentally get healthy in today's world
I
because
know.
we have comfort and ease and simplicity to just like be lazy and eat
Yeah.
fast food, and so you have to consciously go, I got to work out, I got to manage my stress. Like it's all got to, for it
Yeah.
to be maximum impact, you
Yeah.
know, and that's just like a constant evolution that you just keep
Yeah.
unfolding, you know. So
Yeah. And it's not easy, it is not easy. And that's, I think, the hardest part,
yeah,
Yeah.
is
it's hard.
trying to implement these changes if someone's not ever been aware.
Yeah,
Yeah.
Mhm.
yeah, but it starts with that, being aware of like,
Yeah.
holy shit, these fries are not good for me.
Yes,
You know?
yes. And just like you guys are saying, just knowing your numbers is so
Yeah.
important. Yeah.
Yeah. Um, Former smoker, former drinker, you well know that. You've seen us in our glory days. So
I
I
didn't
think,
know I kind of forgot about the smoker part.
yeah, I probably smoked for almost 10 years.
Oh,
And
really? I
Greg
did not
was
know that.
Greg was a pack or two a day or for
Yeah.
a long time.
Oh,
Yeah.
Yeah. When we
okay.
stopped drinking 10
I knew
years
that.
ago, the smoking went out the window with it for sure, for
Oh,
good.
good.
But it's still very difficult, both very difficult things to kick. My
Yeah.
question was going to be like, you see people come in, lifestyle choices contribute to their overall heart health, and it sneaks in and it causes some problems later on that maybe you weren't paying attention to in your 20s, 30s, or worried about. How does quitting both of those things or limiting them or adjusting them reverse the damage that's been done or the problems or the symptoms that people are experiencing? Is it something that's trackable and measurable and a quick thing that happens, or is there data to support that, or what does that look like? And I'm asking, more curious for like, what does that mean to me 10 years later? What does it look like? What does my heart look like from all the damage that I've done in my previous life of not paying attention or caring?
I mean, our bodies are pretty amazing. They can recover. And that's what's so unique. I mean, of course, I work in the heart world. We see, like I mentioned in the beginning, you can have a stress-induced, basically like heart failure. You can have an alcohol-induced heart failure, but our heart is a muscle and it actually recovers. So it can take, I mean, sometimes 3 months. I mean, we say 3 months of, what if alcohol cessation or in medical therapy. I mean, certainly with the addition of, modern science with medication, it can improve over time. So our hearts can recover. And that's specific to, like, again, alcohol or removing whatever that was the cause. There's many causes, but anyhow, the heart, like reversible, as you're saying, certainly plaque in the coronary arteries, regression, I should say. Like you have plaque in your coronary arteries, there can be plaque regression if you do change your diet, if you do quit smoking. The healthy lifestyle changes and lower blood pressure and all that can regress heart issues. So definitely a benefit to changing those habits.
Yeah, it's not like I have done all this damage and
Mm-mm.
I quit, but later I may show up, having these issues because of the damage that I've done. The quitting, maybe, right, if I'm lucky, but
because you were young enough when you quit, probably.
Yeah.
What's one of the biggest misconceptions that people have about heart health and the things that you see when people come in with issues or with concerns? What's a big misconception about, that you wish people knew? Like, Even if it's simple and basic.
Mm-hmm.
Shout it from the mountain.
I would shout from the mountain what I shouted earlier, that list.
Yeah.
Yeah. Okay.
I mean,
Yeah.
that is every day I am working. That conversation comes up multiple times a day because it's so important. I
Yeah.
mean, for all facets of heart health, whether it be, I know we've talked about heart rhythm a lot, or we've talked about heart failure, or we've talked about coronary artery disease. And it carries over to every other part, you know, your brain health, your kidneys. So I would scream from the mountaintop that cigarette smoking, alcohol, weight, activity, keep up your activity, know your numbers, know your blood pressure, know your cholesterol, and best you can with what resources you have, minimize stress.
Yeah.
And
Yeah.
that's
We're
not a
all,
misconception. That's just, well, maybe, you know, maybe it's a misconception. People don't realize that certain things in their lifestyle, it is really important.
Yeah.
yeah, I think we're just clobbered over the head with so much information and misinformation through news, social media, you know.
And I think one thing, sorry to interrupt you,
No, go
but that
ahead.
just really, that those things can do so much more for you than, even though I prescribe medicine, you know, medicine will not fix everything. You know, medications and pills can be given to help blood pressure and can be given to help things, but if people can do their part and take care of their bodies and themselves, it will do much more.
Yeah.
Yeah.
Like your body and movement is the best medicine
Yes.
to improve some of these things.
Yep. The movement and the whatever you're putting in your body, whether it be, you know, from all those things we talked about, from your diet to substances.
Yeah.
I have a question, kind of a little different gear here, but I love coffee, and I'm sure lots of people out there love drinking coffee. It's like, you can take away my beer and my cigarettes, but please don't take my coffee. Don't take my coffee. You know, I mean, it's like part of my life. You know,
Yeah.
is it really that bad for me? I mean, I could
Mm-mm.
even like, I'm gonna just call. I mean, a pot a day, is that? I know that's too
Oh.
much. I know that's too much.
He's not lying. He's
Oh
not
yeah, that
lying,
is kind
Abby.
of a lot. But
Okay.
honestly, you know, when a previous thing we looked at or talk I did was on again, heart rhythm stuff. Caffeine was not directly linked to heart rhythm disorders, but it was directly linked for some people as a trigger. So it depends on, again, each person, but it's not been shown that it's going to cause a heart rhythm problem or cause, again, heart disease or any heart issue, caffeine. So that, but I would touch on in moderation probably would
Yeah.
be the, and then those I mean, this is again a little off subject, but the energy drinks, like you know, Celsius and different things that have high amounts of caffeine, those can certainly be a trigger for people
Yeah.
with rhythm issues or trigger a rhythm issue.
Can you speak more about that? Because I also drink coffee, but I'm one that sits over here and says, don't take my Red Bull. Please don't take my Red Bull. And I've been doing so well. I haven't even purchased it because if it's not in the house, I won't go for it.
Yeah.
I won't stop and get one kind of thing. But I love my Red Bull and I don't want it to go away. So can you speak more to like what that means with the high levels of caffeine being a trigger for like a higher?
Yeah, I think Red Bull's not quite as bad, right? Isn't it only like 80 or is
Well,
it?
It depends on what size you drink. So
okay.
kind of back to that moderation conversation.
Okay.
You know, the
Yeah.
8-ouncer is probably 80 milligrams, but when I'm drinking like a 12 or 16 or
okay. Yeah, you know,
shame.
Yeah, I think I mean, again, we always see the back end of it, like someone's coming in with a heart rhythm issue, and then, or like, yeah, again, it's usually fast heart rates with stuff like that, or palpitations.
Yeah.
So you mentioned like you feel that sometimes, like you'll feel that, and it does happen. It's common, like a quick flutter, or a quick skip beat. We will, and we get that a lot. We see people with that a lot, and there is concern. They, you know, was something wrong with my heart rhythm, and then we have to dive into what are you drinking. So if you're correlating it with those types of drinks, you know, then maybe that's a trigger for you. But and I guess the other thing would be just I don't know that there's a lot of data out there yet as far as like the long-term effect if you like, you're drinking those and then you're exercising and all that stuff. I think that might be a little bit tricky. It is a stimulant, so.
Yeah, right. I don't drink them before I go do a boxing workout.
Okay.
So,
yeah.
or run or anything like that.
Yeah.
But I've been so good. I've been so good.
Yeah.
I often wonder though, like, and you mentioned about the devices tracking when there's a regular rhythm. Like I have these heart flutters, my ring doesn't say anything. I must be okay. Like, is that a trustworthy thing to think? Like, because I am probably perimenopausal, because I do drink a lot of caffeine, because that is probably somewhat normal. It isn't maybe a pattern. Is that accurate?
Yeah. No, I'm glad you said that, because these devices don't pick up all your regular abnormal heart rhythms. They mainly, I believe what they've been looked at is atrial fibrillation, at least the Apple Watches. I'm not as familiar with the rings, but so if you are having a lot of skipped beats, it may not pick that up on your device. And I say skipped beats, that can mean like an early beat coming out of the top part of your heart or out of the bottom part of your heart. And that's what you feel when someone feels a palpitation. Sometimes it's just an extra beat. And that can be normal, but it can be triggered by caffeine, lack of sleep, dehydration. Lots of things can trigger these early beats or extra beats that feel like a flip flutter. People describe a dropped beat, different things can trigger those. And if that's happening a lot, that may not pick up on your watch or your device. So you would certainly want to, we encourage people, you're feeling it often, then you do need what we call like a medical grade ambulatory or heart rhythm monitoring. So then we order someone to have a monitor on for 24 hours that is actually really picking up the rhythm and read by like the cardiologist. Or you can wear a 1 week monitor, 2 week monitor, 3 week monitor. Depends on how often someone's symptoms and how concerning they might sound for an arrhythmia. So we don't, we use these, and this is just from a healthcare provider perspective, they're used as a tool, but if there's concern, certainly we order like the medical grade monitoring. So if
that makes sense.
I would kind of keep that in mind. I don't think it doesn't sound like you're having symptoms like that, but
I don't think so. I think it's probably pretty common though for our age group or younger, because we do drink a lot of coffee. We do have a lot of stress. We do drink energy drinks. We do, maybe push ourselves to max out our physical activity where we might have those from time to time. And,
and
we are wearing the devices. Yeah. So every once in a while I'll feel it and be like, I've had too much caffeine, and it's always coffee that gets the bad rap, but
and we always say too, as long as you're not having other symptoms with it, that's kind of the difference between like, oh, that feels kind of funny versus like, oh, I feel really funny. Like if someone's having lightheadedness with it, or they feel like they're going to pass out, that's concerning.
Okay. And so now that you've said that, and I want to be respectful of your time, and I will wrap this up and stop. I could ask you a million questions and they would be all over the place.
We've covered a lot of topics.
We have. It's more than you probably thought you bargained for here, but it's such great information. Like,
I think it is. I mean, the heart is near and dear to my heart. So I love letting the population education.
Yes. Well, thank you again. For sharing all of this, because it's from a high level, very helpful. But my question was going to be like, I should know this. And there's two. I always come at you with two questions. What are the symptoms of a heart attack? And what are the symptoms of a stroke? Because we are of the age where I should be mindful, be paying attention of like what's happening, and know these symptoms in the event that there's something happening around me. So can you tell us from a high level what we should be paying attention to?
Yeah. So from a heart standpoint, obviously you would know if you were at rest and you're having crushing chest pain, clearly that is unrelieved. Someone goes to the emergency room for that. That'll take someone to the ER. But a less noticeable symptom would be, and not necessarily heart attack, but awareness of maybe heart disease or plugged artery. We always discuss, if you're having chest pain every time you go up to walk around the grocery store, if you're climbing a flight of stairs and you're getting chest pain each time you're active, that's concerning. Because the heart is pumping harder, trying to work harder when you're more active. So when you're active, if the blood is not getting through your coronary arteries well, you're going to have chest pain. meaning like you're getting a plugged artery, getting closer to maybe having a heart attack, then you would be having chest pain is the most typical with activity. Alternatively, watching for shortness of breath. That's often one that's kind of masked, unexplained shortness of breath. People often think chest pain with blocked artery, but it can also present commonly as shortness of breath. Those are the two more like red flags to be aware of for heart, possible heart attack or coming on. Now, if you're saying active heart attack, that would be, again, you chest pain, jaw pain, any unusual pain. I mean, I've had people have like elbow pain, back pain between the shoulder blades, unexplained pain that's not relieved. And that can become tricky. But
yeah, I just think I lay awake at night worried about some of these things. Not often. I'm not like heavy on the anxiety of this, but just sometimes where I wonder, like, would I know? Would I know? Is it so severe that you just know? Or is it something that, like, because you read articles about people who it just happens all of a sudden, they had no clue, they just woke up feeling normal and all of a sudden.
Yeah, I've seen it both ways. It's can come out of nowhere.
Yeah.
But can happen progressive, like we talked about with pain with activity or breathing.
And a stroke.
So yeah, strokes, certainly any, that's what you kind of think about. You have numbness, one side of the body, change, difficulty with words. Usually it's most commonly speech or numbness, loss of use of an arm, leg, or memory, like, someone's not making any sense. I think those would be the big ones, or visual, vision loss.
I think everyone probably wonders about that too. As you start experiencing different things, especially as we age, is this normal, or is this something I should be concerned with? So thank you for that. Just kind of high level, general, thing to pay attention to. That helps me. I'll be able to sleep a little better at night.
I mean, one other one is like obviously unrelieved, unexplained headache, crushing headache. Yeah. That's something obviously you don't ignore.
Yeah. Oh gosh, I could just keep going, but I feel like what's going to happen is what happens when we have experts on, like we had a DEXA scan expert on recently.
Oh, yeah.
And Greg and I had DEXA scans and discussed our results at the level we were able to explain them, and which was not awesome. So then we had someone who was awesome come on and talk about the DEXA scan. And then we see questions come in. So what I think will happen is likely that this episode comes out and people are like, wait, what about this? And then it won't just be me randomly asking you a cluster of questions, because I'm curious about everything, and maybe a little bit more specific to what people are seeing or experiencing as well. So
no, that's great. Yeah, and it is. There's a lot of things that we see as far as concern for heart issues. Chest is a commonplace. Things settle, and people want to know, why am I feeling this? What does this mean? And it's normal.
What is the deal with baby aspirin is my last question. Should I have baby aspirin around just in case?
It used to be, they would say, oh, everyone should be taking baby aspirin. That has changed, unless you have an indication, meaning, you have heart disease already or high risk for heart disease. Typically we're not recommending baby aspirin for everyone anymore every day, just because of the potential side effect from it and the GI issues. So you're asking having it around for, like, if you had chest pain?
Well, yeah, like if I would feel terrible if something would happen and I was not prepared with any aspirin. I don't have any aspirin in the house. So while we're talking about this, it's like, maybe I should get some.
I mean, I don't think, I guess I shouldn't say you're not at risk, but you're minimal risk. I would consider you both very minimal risk. But certainly if you did develop chest pain and you were home alone, or you were somewhere, like you taking, chewing 4 baby aspirin is what we would, you might give to somebody if they were in clinic, or the EMS if they came and someone was having chest pain. So taking aspirin right away will help, because it's antiplatelet, meaning blood thins the blood, prevent clotting, all that.
Yeah. So the validity in that theory or that practice of having the aspirin in the event that someone is having a heart attack is a valuable source of information.
Yeah. That is something that is given in the act of, having a heart attack.
What else you got, Greg? Do you have questions?
Well, that's probably what saved my dad's life. My mom had for baby aspirin. And
Oh, really?
yeah.
Yeah. Well, thank you so much, Abby, for sharing all of this information with us. I think so many listeners benefit from having at least a high level knowledge of what they need to pay attention to. And with so much being thrown at us, we don't always know what that is. So having an expert like you, someone who sees this day in and day out, give us the advice and the ins and outs of what you see and what can benefit us is so very helpful. And we're very grateful for your time and your knowledge. So we appreciate it. Thank you.
Yeah, well, thank you. I appreciate you having me. It was a fun talk.
And also thank you for being an amazing wife to my best buddy, Michael.
It's hard work, but you know,
Somebody's got to do it.
yeah,
right?
I've put
Somebody's
up
gotta
with
do
them
it.
for this long.
Yes. And
Yeah.
that shows in your children as well. Your
Yeah.
stellar little kids.
No.
They're lucky to have you as their mom. So thank you for that
No.
too.
Well, thank you. Yep.
Always juggling a lot as a
I know.
professional and a mom and a Mike wife. Well, thank you all so much for joining us on the Cameo Show. We have new episodes every Wednesday. And if you have questions for Abby or anything sparked your interest or intrigued your curiosity about your heart health, please let us know and we will get with Abby on finding the answers for you. I will try to articulate them, but we might have to have her back if they're over my head, which they probably will be. But please join us again. We're so grateful that you're here. We'll see you all next time.